Hello, I'm Dr. Franco, the Medical Director at the Arthritis Center of Riverside. I'm a rheumatologist and I would like to discuss with you some concepts which are different from the mainstream about rheumatic diseases. It's important to recognize that rheumatic diseases, many of which have been considered diseases of autoimmunity, that is to say that the body is fighting the body. We fight self. Well, that in a way is a misnomer, because I believe that there are underlying causes for the immune system to fight something that is within the host, within the body. And all too frequently, these are infections. Rheumatic diseases are very complex. Patients can have a diversity of symptoms, and what we're trying to do is to find the cause of rheumatic diseases so that we, instead of treating symptoms, we can treat the root cause. So the cause has been elusive for many, many years. Our research shows that infections such as mycoplasma infection can cause different rheumatic diseases, and we have found that about half of our patients who had chronic fatigue syndrome, fibromyalgia, rheumatoid arthritis, and Gulf War illness had evidence of mycoplasma species infections. They had different species, and some patients had more than one species. Usually the ones that had the disease for a longer period of time were more symptomatic. Rheumatoid arthritis is one of the more common rheumatic diseases. It is a disease that affects multiple joints, and it produces disability because there can be a potential for joint destruction. This is caused by inflammation. We can monitor that looking at the markers of inflammation. But we also look at infectious agents, including viral agents like parvovirus, agents like mycoplasmas, chlamydia pneumonia, as well as streptococcal infections. To complicate matters, the classical rheumatoid factor, which has been used to diagnose rheumatoid arthritis, is not present in many patients who have rheumatoid arthritis. There is another test called cyclic citrullinated peptide, but it's important to note that even those patients that have a negative rheumatoid factor may have infections as well, causing arthritis or other rheumatic diseases. The rheumatoid factor is present in different rheumatic diseases. So then, if this is the hallmark of rheumatoid arthritis, why is it present in other diseases, other rheumatic diseases? Like example, systemic lupus erythematosus. Well, that's because the rheumatoid factor is a series of immune complexes. It's an antibody which has a Y shape. There are 5 antibodies together with a nucleus, and these are circulating. Rheumatoid factors also are present in infections like hepatitis, tuberculosis, subacute bacterial endocarditis. So you see, there's something else to the rheumatoid factor. It's not necessarily a hallmark of rheumatoid arthritis, but maybe it's indicative that the immune system is fighting something, in this case, very possibly infections. We have done research in many patients who have rheumatoid arthritis. We have found that more than half of them have mycoplasma infection, and less than 10%, usually less than 5% of the healthy controls have mycoplasma infection. So that's a big difference. Therefore, when we treat them with antibiotics, that might be the reason why they get better. It's true that there are antibiotics that have anti-inflammatory properties, like the tetracycline family. Well, that's a useful tool as well. Rheumatoid arthritis is a disease that can affect multiple joints and can produce disability. If we treat it on time, we will avoid that. It is important to note that when we start treatment closer to the disease onset, the results are better. And also when patients are younger, probably because their immune system is healthier and stronger. And that's why it's so important to try to boost the immune function and to use natural anti-inflammatories that will not depress the immune system. One of the commonly used drugs is prednisone, which has multiple side effects. It can be very useful, but it can be very deleterious and toxic at times. Over the past 30 years, I have seen patients with rheumatic diseases, and my experience shows, which is confirmed with our research, that infections can trigger rheumatic diseases and can be treated appropriately with antimicrobials. There are different antimicrobials that can be used. including the prescription medications as well as nutritional supplements, which are geared to boost the immune system to fight the infection. We have achieved a good success in patients who have rheumatoid arthritis. We use both tools, the conventional tools and the alternative tools, in a complementary way to promote the improvement and well-being of patients.
I had a real bad scleroderma crisis, kidney crisis, caused congestive heart failure and total renal failure.
I got a vicious case of rheumatoid arthritis.
I got a nerve injury at RSD, and that caused fibromyalgia.
I couldn't even drive anymore.
I was in a lot of pain. I was in pain all the time.
A lot of people didn't think I was even going to live.
Dr. Franco's therapy and everything has really turned everything around for me.
The first month I felt better.
Believe this, he saved my life.
He's great. He's great.
He's made the difference between, hope and no hope.